Do you wonder if you're the best version of yourself? This is the question we seek to answer in this podcast. We reveal information that helps you recover your health and become resilient. Modern life makes us fragile. Our diet, lifestyle, and environment set us up for failure. We do not accept this. We seek optimization. We strive to become dynamic. Hey, what's going on? Dr. Chris here. Today we're diving back into the world of balance and vertigo, talking about something very specific called Superior Canal Dehiscence. Something very rare in my 13 plus years of practice. I've seen it maybe 2 to 3 times, and this is one of my specialties is vertigo, so I do attract a lot of balance and vertigo patients, and it's a very rare thing. The reason I wanted to bring it up is because the vertigo world is very specialty, so there's a lot of things that people don't know about, a lot of practitioners don't know about it, so I kind of want to bring awareness to this, because if you're experiencing this, chances are you've been bouncing around from practitioner and practitioner for years trying to figure out what is going on. And I've seen this pattern too often in the vertigo world, where people are just misdiagnosed or misunderstood. I've told this story before on the podcast. We're going to tell it again. My first year as a student, I was in rotations, and my first rotation was in the ER, and I was with a therapist. So you basically follow along with a CI, a clinical instructor, who's a certified therapist, and you just kind of do what they tell you to do. Anyways, she was trained in vestibular therapy, and we're in the ER, and this woman is there with extreme vertigo, and she's about to have a surgery to remove or dissect her vestibular cochlear nerve, which would leave her with a permanent Bell's palsy of the face because her vertigo is so bad. Luckily, the therapist I was with knew of something called BPPV, which I've also talked about, I believe, in the podcast. That's the crystals in the ear problem. That's severe room-spinning dizziness with positional head changes, and it's actually very easy to fix. Usually 15 minutes it takes me to fix it. 1, sometimes 2 sessions. Very simple. But the practitioners she had seen in the hospital didn't know about it, and they were going to do a very invasive surgery. The therapist caught it and treated her, and she was discharged that day without any surgery. So that is unfortunately landscape currently, at least where I am in the world, of the vestibular and vertigo world. So let me get into superior canal dehiscence. Let's go over the symptoms first. So some typical symptoms are dizziness that's triggered by loud noises. If you hear like someone in the car with a loud bass next to you, and you hear that thump of the bass, I'm not talking about it's annoying. Of course, it can be annoying, but that will trigger some vertigo and dizziness. Pressure changes, coughing or sneezing, so any kind of intracranial pressure can increase the dizziness and symptoms. You may be able to hear your pulse in your ear, that's a common complaint, or even things like your eye movement you can hear in your ear. You may be having some hearing loss, which has to do with conduction in your head. It could also be tinnitus, or some people call it tinnitus, which is ringing in the ears, but that does go with a lot of different vertigo problems, so that's just one thing included on this list. Another symptom is fatigue. Now, I don't really bring that one up because that seems to go with every symptom of everything in the world, but there's also something called a tragus sign. So the tragus is that little flap of skin and cartilage that covers the hole in your ear. If you press that in with your finger and that causes dizziness, that's a classic sign of superior canal dehiscence. So how do we diagnose this? Unfortunately, this again gets missed a lot. The gold standard to diagnose it is a CT scan. There is something called a VEMP test, which is a special vestibular evoked myogenic potential test. It's an inner ear function test. But again, I've sent people out and told the ENT, this is what I think it is, and they seem to scratch their head and not really do the test. This is one of those things where you might have to find a specialist. You might have to go to another city or fly somewhere, unfortunately, to get this properly diagnosed. So what the heck is this thing? So you have something called the oval window. This is the temporal bone, which is just above your ear, so the side of your cranium. there is a spot called the oval window, and if that part of the bone is thin or absent, if it's congenital, you may be born without it, this is what causes it. Or it can erode with time. We don't fully understand why. Intracranial pressure can do it, so excessive straining might contribute to it. We're not really sure. So what that does, it basically amplifies or distorts pressure and sound passing through that area. And this amplification of pressure and sound is what causes all the symptoms. All right, so what are your options? This is a tough one. There's basically surgery to correct and repair the oval window. That's probably the more severe cases. And there is some things that therapy can do. It just depends on your symptoms. So first of all, let me just back up and say it is possible to have this and be asymptomatic. So severity dictates everything. If you have a difficulty keeping your gaze fixed on something, that's called VOR, is a VOR hypofunction. The vestibular ocular reflex is your body's ability and your eye's ability to stay fixed on something and move your head. Sometimes this reflex, with basically any vertigo or balance disorder, becomes perturbed and sort of what I would call miscalibrated. So it's kind of a sequelae, a secondary symptom of the issue. Physical therapy can definitely help that. So what I would say is if you suspect that this is what's going on with you, find a therapist that understands vestibular therapy. Vestibular is our word to describe the balance mechanism in the inner ear. And they can at least get you on the right path. Maybe they can help you figure out, okay, this sounds like, we can't diagnose, but this sounds like superior canal dehiscence. Maybe they can look at your reflex, that is the gaze stabilization I was talking about, and they can address that. And if that doesn't clear up your symptoms, then they may have to pass you on, refer you out to somebody who is a specialist in this area. So that's all for this podcast for today. A quick one. I just wanted to, again, bring awareness to this because I've seen too many people that have been suffering for too long with no proper diagnosis. A ship in harbor is safe, but that's not what ships are meant to do. What does this mean? It means exposing yourself to difficult situations so you become resilient. If you need help building resilience, check out our flagship program called Physiologic Flexibility. This is a 3-month do-it-yourself program that teaches you how to maximize your homeostatic regulators, such as your pH, blood glucose, O2 and CO2 tolerance, and temperature. We give you specific action items through the program with the goal of becoming anti-fragile. If you want to become the inspiration for your friends and family, this is the program for you.